Lean culture for me has been an interesting journey.
Lean is a profoundly different way to work.
What can we do to minimize waste and focus on value-added work?
Letting go of old ways.
Lean culture means doing the right thing for the patient.
I will be completely honest with you and said that when this process started, I was trying to find a corner where I could hide.
We've always done it that way is a common comment that we make in healthcare.
Well, when this first started, I was skeptical.
It was so much easier just to leave things the way they were.
And what we realized is patients wait in a lot of different areas in the department. They wait to see the triage nurse, they wait for the receptionist, they wait in the lobby.
That's the way we've always done things, is an easy answer.
We may have accepted, well, this is just, a challenge in our healthcare environment.
Then they wait to be pulled in by a nurse. Then they wait to see the nurse. Then they wait to see the doctor.
It does start people on a journey to think, why? Why have we always done it this way? Why can't we do it some other way?
Really, it opens your eyes to getting beyond the status quo and looking for opportunities.
As you start engaging, it has a bit of an infectious quality to it. I think it's opened our eyes.
What staff found to be troublesome is the fact that patients would come for a pre-admission visit for surgery. They would be there 5.5, 6 hours across the day, seeing various health professionals, having their diagnostic tests. And they were clear that that wasn't a patient-centered approach. So they looked at, let's put the patient in a room and we'll go to the patient. I thought they did a fantastic job.
We found that a lot of us were running around from one end of the department to the other. And as you can imagine, we have fairly big two emergency departments. So how could we minimize that? So we came up with strategies to reduce the walking of the triage nurse, reduce the walking of the charge nurse.
The nurse used to go and take the patient from the lobby and then take them down to our rapid assessment zone. What we did was
we put much better signage, such as blue arrows on the ground.
We gave patients their chart right from the receptionist, and from reception we told them, make your own way following the arrows down to the new waiting room.
The patients can actually follow so that nobody have to chaperone them from one end of the department to the other.
This was not only helpful for the patients, but it was also really helpful for our nursing staff because it allowed them to move on to the next patient more efficiently and quicker. So that meant the next patient was also benefiting from this change.
We saved about 30% of time.
50% reduction, which is fantastic.
The lymphoma clinic actually went from patients waiting up to 90 minutes down to patients waiting about 15 to 20 minutes to be seen by a physician.
So I was able to have about a 20% increase in my capacity in my clinics.
In the end, you learn it's a win-win for everybody, and the bottom line, it's a win-win for the patient.
I think Lean gave us a way to look at our work environment in a different way. Staff had the ideas, they had the will.
I really see a sense of pride in that and a sense of ownership.
You can't stop them from talking about it. They're so enthusiastic.
Wow, this is actually making a difference. I get to spend more time with the patient. I get to spend more time with my colleagues doing added value work.
We've actually written up our lean experience in the clinic, and we'll be presenting at an international meeting in Washington.
I mean, it's about giving the best care. So I think it's core to UHN's mission to be excellent lean innovators.
So for our staff, change is now every day. It's looking at how can we make every day better. The payoff is that you're doing the right thing. You're doing the right thing for our patients.
What I like about lean is it focuses you on the thing that you have to deliver on, and that's great care to the patient. And you can always improve that.